This week we're going to continue to look at the muscles of the thorax by looking at the deeper muscles of the spine. These include the erector spinae, the transversospinalis group, the splenius capitis and cervicis, and the suboccipitals. The erector spinae muscles, from medial to lateral, are the spinalis, which means that it's closer to the spine, the longissimus, which means that it's the longest of the erector spinae, and the iliocostalis, which means that it's attached to the ilium and the ribs. The next group is the transversospinalis. From deep to superficial are the rotatories, the multifida, and the semispinalis capitis. These last two groups of muscles we looked at last week, and the same muscles are the splenius capitis and the splenius cervicis, and the four suboccipital muscles. Your book can be a little bit confusing in how it presents diagrams of these muscles. The author shows different branches of the same muscle on the right side and the left side. What you need to remember is that these branches of these specific muscles are on both sides of the body, so that it's the same muscles on the right and on the left. The erector spinae group, they're responsible when they act unilaterally for lateral flexion, which means that they act on one side of the body or the other. So when you contract your erector spinae on your right, you laterally flex to the right. Together, they're extension of the spine. Each one of these muscles is composed of different sections having different names, so you're going to see that in the next few diagrams. There are different branches. This picture shows the spinalis thoracis, which means it's attached to thoracic spinous process. The spinalis cervicis, it means it's attached to the spinous process of the cervical vertebra. This picture shows the longissimus thoracis, again having attachments on the thoracic vertebra and also on the common tendon. This is the thoracolumbar aponeurosis, which just means that it's a broad, flat tendon. Anytime you see aponeurosis, that's what it means. It's a broad, flat tendon. And you can see it's depicted with this white area here. And also you have the longissimus capitis, which means it's just attached to the head. This is a picture of the iliocostalis cervicis and the iliocostalis thoracis. And for this particular muscle, you also have an iliocostalis lumborum. And again, you can see the thoracolumbar aponeurosis here, the broad flat tendon. And this picture actually gives you a nice view of all of the erector spinae muscles and showing how that the muscles are on both sides of the spine, not as depicted in your book. The transversospinalis group, from deep to superficial, are the rotatories, which span from 1 to 2 vertebrae, the multifida, which span 2 to 4 vertebrae, and the semispinalis capitis. If you look at your book on page 200 and 201, there are actually some really good diagrams of the multifida and the rotatories muscles. And if you look at the picture on page 200, you're going to see the rotatories, which are the deeper muscles on the right-hand side of the body, and then overlaying them will be the multifida muscles on the left side of the body. Here is a picture of the rotatories by themselves. And you can see how tiny they are, little tiny muscles, which means that they're able to do very fine, tiny movements. And the only thing that these muscles move are the joints between the vertebrae. Remember, a muscle can only shorten and lengthen, and it moves the joint over which it crosses. So this is a very tiny movement. The multifida muscles overlap the rotatories muscle, and you can see that here in this picture, and also included in this picture is the quadratus lumborum. This here continues the semispinalis capitis up at the top, the most superior part of the picture, and then again it's a picture of the quadratus laborum here. These are the spinae muscles, which again would be a review for you. We did these last week, and here's a picture, a really good picture of the splenius capitis muscle here. And again, you can see how right here are the erector spinae muscles and how the layering of the muscles happens. So these are deeper, and then you have the splenius capitis. And remember, over all of this, you have the trapezius, you have the latissimus dorsi, and you have the rhomboids that are here on the upper spine. And again, the suboccipitals, picture of the suboccipitals, which again we did last week, the small muscles that allow us to tilt and rock our head.